Hey, since I enjoy pissing off my COVID deniers, I thought this one was interesting because they always say that flu cases are down and they're not reporting the flu because they're adding flu cases to COVID cases, right? That's the rumor. So I guess that's my personality. They deny it and they get upset because I post something. So instead of not posting it, guess what I do? I post more. I normally post more until you guys shut up. But in the spirit of me being cantankerous and curmudgeon, let's do this. No, flu cases are not down 98% around the world, despite what you might have read. And this is coming from OregonLive.com. And the Associated Press checks out some of the most popular but completely untrue stories and visuals of the week. This one is bogus even though it was shared widely on social media. Like I said, we got a lot of YouTube scholars in my sub count because they could find out about the flu from the CDC in about 10 minutes. Just punch in flu and CDC and it'll come right up. Right from the CDC, how they calculate the flu. The flu is always estimated every year. They don't have always exact tests. So they take the tests that come in, they take the death certificates that come in, and they run an estimate compared to a historical pattern. Unlike COVID-19, you don't need a test for every flu case. And every flu case by the CDC is not counted. It's estimated. They tell you it's estimated on their site. And they even give you the formula about how they do it, but most people don't read. Anyway, claim new data shows flu cases are down 98% around the globe. Facts. Social media posts making this claim are provided incomplete information, relying solely on data from countries like in the Southern Hemisphere like New Zealand and Australia. The Northern Hemisphere has yet to experience its full flu season. But while the claim isn't true, there is some good news to be found here. Experts say that the extensive measures taken in these countries, from wearing masks, lockdowns, social distancing, has contributed to low flu numbers this year. That would make sense. If you're not being exposed to other people, guess what you're not going to catch? Wait for it. Wait for it. The flu. The same measures that keep you from catching COVID-19 are the same measures that keep you from catching the flu. But Negroes don't really think that far. COVID-19 is probably more contagious than the flu, according to them. But in both cases, the numbers are going to be down. Anyway, while some posts online did not cite evidence for the figures, others pointed to newly released data from the World Health Organization to suggest that flu cases are down by 98% around the world. The WHO has not said that. Its latest influenza update based on flu cases reported from September 29th to October 11th, WHO found that the global influenza numbers are lower than expected for this time of year. Although the Southern Hemisphere seems to have been largely spared, we are still very concerned about the Northern Hemisphere influenza season just starting. It's just starting, folks. In fact, the 2019-2020 influenza numbers, which I do believe became reasonably final like a month or so ago, said that it was right in line with historical patterns. I think the year before was right around 33,000, and I think last year was 22,000. It's not a steady rate, okay? It goes up and down, and those are deaths that are not necessarily flu cases. I think the flu cases were like 68 million. There are actually more flu cases than COVID cases, but the deaths were down. In fact, what they were saying, I'll probably have to find an article, is because of the COVID testing, they actually had more flu tests. So the flu cases actually went up. because when they were looking for COVID, testing for COVID, they found flu. They don't normally test for the flu. Anyway, medical professionals in the U.S. have been warning of a twindemic, an overlap of influenza and COVID-19, which have similar symptoms. In areas where people properly wear masks, we see very low rates of COVID-19 and influenza, said Dr. Gregory, Poland infectious disease expert and head of vaccine research at the Mayo Clinic. In the areas where people are not compliant with mask wearing and distancing guidelines, we see both diseases, with COVID-19 more prominent because of its greater infectiousness. In New Zealand, where there was a strict approach to the pandemic, officials reported a 25 coronavirus deaths in a country with a population of about 5 million. Officials have been applauded for handling of the coronavirus pandemic. The country took early action against the virus and has worked to almost eliminate community transmission. The efforts that were undertaken to reduce the spread of SARS-CoV-2 were also effective at reducing the flu, said Edward Bologna, director for the Center of Clinical Epidemiology and Population Health at the Marshfield Clinic Research Institute in Wisconsin. They are both respiratory viruses that spread in similar ways. Medical experts like Bologna warned that the U.S. has not initiated steps like mask wearing and lockdowns on the same level as Australia and New Zealand to control the pandemic, so the flu remains a large concern. Flu could be a very real problem again this year as it was last year, Poland said. Don't neglect your flu vaccine. Here's another one real quick. Salona County confirms first case of patients suffering both coronavirus and flu. The beginnings of what could end up being a dual pandemic has hit Solano County. The Public Health Department reported Friday the first patient suffering from both the flu and COVID-19. Solano County Health Officers Dr. Bela Matias says the patient is under the age of 65 and is in fairly good health. This person works in the healthcare sector, but Matias said that's not where the transmission occurred. This is basically warning us we have flu in our community as well as COVID, Matias says. Dr. Matias believes that the first case of co-infection happened because the patient didn't follow proper social distancing guidelines. This person, to the best of our knowledge, didn't acquire it in the workplace. They did what so many other people did all over the country. They got together with family and friends and let their guard down, Dr. Matias said. Dr. Matias says such gatherings are how more than 90% of COVID-19 infections are occurring in Solano County, pushing the county to the brink of the purple tier for widespread risk. Obviously, we're not telling people to get together with family and friends. We're suggesting when you do, use common sense and take responsibility for your actions. Don't go to a gathering if you're sick. So in other words, here's the last piece. As the peak flu season approaches, doctors are urging people to get the vaccine to reduce the risk of becoming seriously ill. Some of the symptoms of flu and COVID-19 are similar. Dr. Matias says you should quarantine until you know what you have. So there you have it. People don't read. They said that that COVID-19 kills heart disease, the heart disease stats. I think there was a stat I saw that 800,000 people die of heart disease. In fact, heart disease or cardiovascular disease is still the leading cause of death. COVID-19 is not. They're warning about the flu. We having a flu season peaks in basically December, January, and February. That's when it peaks. We just started flu season in October. They don't finish counting it until, I do believe I think they finish counting in like July or something like that, where they actually give the whole year count and tell you how many people caught it. They estimate how many people caught it. They don't really know because they don't test for everything. And they also estimate how many people died from the actual flu. So there. And that is the refutation of what you guys are talking about. Why don't you guys read for a second? It only takes like 5 minutes to look it up on Google. 5 minutes. You can actually approve or disprove what you've heard. You guys are going by the social media posts and believe in what you hear instead of going back and doing your research. But with that, I'm going to jump off here. This is BGS out, and I'll see you guys on the next one. Peace.